So this remains open and very challenging research question because there's no currently, and probably there never be, head-to-head comparison between the different CAR T-cell products. So the only way we can try to address this question is by performing sophisticated statistical analysis of retrospective real-world data. So this has been done by multiple groups. Multiple groups have compared axi-cel to Kymriah or Breyanzi to Kymriah, and clearly those two products seems to be superior, as you could also infer from the results of the second-line randomized phase 3 trials, where only Yescarta and Breyanzi seem to be superior in that case to salvage chemo followed by transplant, whereas Kymriah didn't win the competition. There's been a very interesting study performed by Dr. Gauthier at the FREDACH a few months ago and published on Blood, where they retrospectively looked into patients who received Yescarta, Kymriah, or JCAR17, which is kind of the precursor of Breyanzi. So it's not directly Breyanzi, but a very similar product. And after performing very sophisticated statistical analysis, matching according to multiple relevant factors such as baseline lymphocyte count or tumor burden, axi-cel seemed to be clearly more toxic, as we already knew, due to the costimulatory domain, but also more active, again, maybe due to CD28 one more time. So clearly, based on those data, it looks like Yescarta may be an ideal option for patients who, of course, can tolerate it, so it may not be elderly or frail patients, as long as there's some concern that based on tumor burden or overall kinetic or growth of cancer, this patient may not respond well to other products. Well, again, this remains to be prospectively demonstrated. I think that those data are very provocative, and based on that, I would say most of us in clinical practice tend to select Yescarta over the other two products when it comes to patients who have a very aggressive presentational lymphoma.